Hi all, I'm Dr. Malati working as a professor in Tripura College of Nursing. So in this video, I'm going to discuss about the amniotic fluid embolism. So it is a kind of obstetrical emergency. The objectives are introduction, definition, phases, predisposing factor, clinical features, emergency management, complication, effect on the fetus, summary and conclusion. Introduction. Amniotic fluid embolism is a rare but life-threatening obstetric emergency that occurs when amniotic fluid or else the fetal cells, hair or other debris enters the maternal bloodstream. It will trigger the severe allergic reaction. So this condition usually develops during the labor process or in the immediate postpartum period. So amniotic fluid embolism is characterized by sudden onset of symptoms such as respiratory distress, hypotension, cardiac collapse, coagulation abnormalities like disseminated intravascular coagulation. It can rapidly progress and also it requires the immediate recognition and prompt multidisciplinary management to save the life of both the mother and the fetus. Although the exact cause is not fully understood, AFE, that is amniotic fluid embolism, is considered unpredictable and unpreventable. So for the nursing students, understanding this AFE is essential because early identification, quick response and supportive care plays a vital role in improving the maternal and fetal outcomes. Definition. Amniotic fluid embolism condition, it occurs when amniotic fluid enters the maternal circulation through a tear in the membrane or in the placenta. Phases. There are two phases. First phase is the initial phase. It occurs due to the vasospasm causing hypoxia, hypotension and cardiovascular collapse. Thereafter, it is followed by second phase, developing the left ventricular failure with hemorrhage and coagulation disorder followed by pulmonary edema can lead to the maternal mortality and morbidity. The presence of thromboplastin. So amniotic fluid is rich in thromboplastin. It enters the maternal circulation, will lead to the block in the pulmonary arteries and also it triggers the complex coagulation mechanism, can lead to disseminated intravascular coagulation. So there will be a severe clotting defect with profuse bleeding from the vagina or through the venipuncture sites due to the consumption of the coagulation factors. Predisposing factors. Amniotic fluid embolism can occur at any stage in the gestational. It is mostly associated with the labor process, though cases in early pregnancy and postpartum have been reported. So the other factors are transfer of amniotic fluid from the uterus to the maternal circulation can be insidiously associated with the tear in the membrane. Next one is amniotic fluid under the pressure also there is a chances to get tear and it may enter the maternal circulation in the first phase of hypoxia during hypertonic uterine activity. Other factors like procedures such as insertion of intrauterine catheter and artificial rupture of membrane can also lead to membrane tear. In cases of placental abruptio, the placental bed is disrupted and the barriers between the maternal circulation and amniotic sac may be breached. So it can also occur during the cesarean section or during the termination of pregnancy or in association with ruptured uterus. Trauma may also occur during intrauterine manipulation such as internal podalic version in the breech presentation. So this condition is actually difficult to predict and also equally difficult to prevent. Clinical features are sudden onset of maternal respiratory distress. The women become severely dyspneic and also cyanosed. Maternal hypotension, uterine hypertonia, fetal distress in response to hypoxia can caused by hypertonia. Then cardiopulmonary arrest follows quickly in minutes. Many mothers present with convulsions immediately preceding the collapse. Emergency management. Any one of the above symptoms is indicative of an acute emergency management. The mother may be in the state of collapse, so resuscitation must be started as early as possible. Then specific management of this condition is life-saving support and high level of oxygen is required. And the mothers who survive may suffer from the neurological impairment due to amniotic fluid embolism. The complications are DIC is likely to occur within 30 minutes of the initial collapse. Acute renal failure can occur due to heavy bleeding and prolonged hypovolemic hypotension. Transfer the mother immediately to the ICU unit for specialized care. Effect of the fetus, perinatal mortality and morbidity are high here, whereas the amniotic fluid embolism occurs before the birth of the baby. So delay in the time from initial maternal collapse to delivery needs to be minimal if fetal death is to be avoided. Summary. Amniotic fluid embolism is a rare, sudden and severe obstetric emergency that occurs when amniotic fluid or fetal debris enters the maternal circulation, leading to the serious reaction. It commonly presents during labor, delivery or during the immediate postpartum period. So the condition is marked by abrupt symptoms such as the difficulty in breathing, low blood pressure, cardiac arrest and bleeding disorders like disseminated intravascular coagulation. Amniotic fluid embolism is unpredictable and cannot be prevented, making early recognition and rapid intervention extremely important. So the management mainly focuses on the supportive care, including the oxygen therapy, fluid resuscitation, blood transfusion, and intensive monitoring. Conclusion. AFE remains a critical cause of maternal and fetal morbidity and mortality. Prompt diagnosis, immediate resuscitative measures, and coordinated teamwork along the healthcare professionals are essential to improve the survival outcomes. Here, the nurses plays a vital role in early detection, continuous monitoring, providing the emergency care, enhancing the knowledge and preparedness among the nursing professionals can significantly contribute to better management and improve patient outcomes. References. Thank you.